You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
DHS Deputy Secretary Julie Willems Van Dijk, Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager, and Traci DeSalvo, the Director of the Bureau of Communicable Diseases. And we begin today with remarks from Deputy Secretary Julie Willems Van Dijk.
Thank you, Elizabeth, and good afternoon, and thank you all for joining us. Back in January, I asked for your patience and your persistence as we ramped up our vaccination effort and continued to work together to stop the spread of COVID-19. That was 2 months ago, and we were only a month into the vaccine rollout. Since our start in December, we have administered over 2 million doses. As of today, 2,148,887 total doses of COVID-19 vaccine in Wisconsin, with 793,954 people completing their series. 23% of Wisconsin residents have started their vaccine series, and over 13% have completed it. And our state is a leader in vaccine administration. We have expanded eligibility many times, and those expansions have come sooner than we originally expected, thanks to increased supply from the federal government and the impressive work of our vaccinators across the state. As of today, our currently eligible populations include healthcare personnel, including those who provide spiritual care, residents and staff of long-term care facilities and other congregate living facilities, public safety personnel like police and fire, as well as essential court personnel like judges, public defenders, and prosecutors, adults aged 65 and older, educators and all staff of K-12 schools and childcare, Wisconsinites enrolled in Medicaid long-term care programs like Family Care and IRIS, and public-facing essential workers like our food supply chain workers, including farmers, grocery clerks, hunger relief workers, and restaurant workers. Starting Monday, March 22nd, all Wisconsin residents who are 16 and older with medical conditions that put them at greater risk of severe illness from COVID-19 will also be eligible. These medical conditions include cancer, COPD, heart conditions like coronary artery disease, diabetes, and sickle cell disease. A complete list can be found on our website. Just go to dhs.wisconsin.gov and click on the banner that says Learn More about getting the COVID-19 vaccine at the top of the page. Your patience and persistence and the hard work of our vaccine team and our network of vaccine providers across the state, it's all paying off. And as we look towards May, when every resident of Wisconsin age 16 and older will be eligible, let's keep up that patience and that persistence. And get ready, because the more people vaccinated in our state, the safer we will be. Stay informed by tuning in here and signing up for our newsletter. Keep up to date on the available vaccines, all 3 of which are very safe and highly effective at preventing illness and death from COVID-19. And make a plan. We have many avenues in our state to get your vaccine. Healthcare providers, local and tribal health departments, pharmacies, community vaccination clinics. Check out our map of vaccine providers to see where vaccine is available in your area. Excuse me. We're excited about our new community vaccination clinics, such as the new site at Lambeau Field, announced by our Brown County partners, including the Brown County Health Department, Bellin Health, and the Packers this week. We're also excited to share that more pharmacies are joining the federal pharmacy program, including Walmart and hometown pharmacies. And through it all, as we look forward to opening up vaccinations in May, we have to remember that COVID-19 is still very present and spreading in our state. We are adding 490 more cases today, which brings our total number of confirmed COVID-19 cases in Wisconsin to 571,220 people. Our 7-day average of new cases is 409. 2 more deaths have been reported, which brings our total number of Wisconsin residents lost to COVID-19 to 6,556. Our hearts go out to the loved ones, neighbors, friends who have experienced these losses. We are still dealing with this pandemic and all of its stressors. So I encourage you to tune into our Facebook Live at 1:30 on Monday, when we'll have mental health professionals fielding your questions about dealing with stress and building resiliency. Before we take your questions, I want to dive a little deeper into our case and death data. If you visited our data web pages recently, you may have seen some changes, and that is because we have been working to refine our data reporting as we do for all communicable diseases. As you know, we have been committed to transparency in the data we received from our 98 local and tribal health departments throughout this pandemic. And part of that commitment means that we try to get the data to you as real time as possible. One example of these efforts that you will see on our website are changes in the number of probable cases and confirmed cases, as we more carefully review the type of laboratory tests that leads to each of these classifications. The good news is that while the numbers may change, the same public health interventions, including contact tracing, isolation, and quarantine, occur regardless of whether you are a confirmed or a probable case. Another area you will see changes is the percent of cases or deaths that live in group housing. When case and death data were inputted into WEDS, our disease surveillance system, it was common for some fields to be empty or boxes left unchecked due to the inability of the disease investigator who conducted the interview to collect that particular information. That is why we had such a high percentage of unknowns when it came to reported COVID-19 cases or deaths by housing setting. We are always looking for creative solutions to improve the data we receive from local health departments. And over the last week, we worked with the regulators within DHS and the Division of Quality Assurance to match data in the disease surveillance system with addresses of Wisconsin's long-term care facilities. And as a result, we have been able to significantly reduce the number of deaths in the unknown housing setting. As we continue our data quality assurance efforts, you may see other changes as we correct and clean other data. For the most accurate and up-to-date picture of COVID-19 in Wisconsin, check out our data visualizations that show cases by date of onset or diagnosis and deaths by date of death. A lot of information to get through today, and so please remember to do your part to stop the spread. Wash your hands, stay home, wear a mask when you are out in public, and physically distance if you have to go out. Get tested if you have symptoms or have been exposed to someone with COVID-19, and get your vaccine when you're eligible. Thank you, and let me turn to you, Elizabeth, for questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you are able to do so, use *6 to mute and unmute your phone. And we do have to wrap up by 2:15 today. So in the interest of time, we ask you to limit yourself to just one question, please, to ensure everyone gets a chance to ask one. Let's begin with Scott Bauer at the Associated Press.
Hi, thanks again for this call. Julie, do you anticipate the percentage of unknown housing that's around 25, 26%? Do you anticipate that being further reduced, or have the revisions that have already been made, is that all that's going to be done?
Yeah, at this time, Scott, I don't anticipate it will be further reduced unless we come up with another creative idea about how to match for some other type of housing. But you know, we thought about the place where we had addresses where we could make those kind of matches, and we've deployed that. And unless one of our team thinks of some other creative way to try and get that additional 26%, I don't anticipate it changing. Anything you'd add to that, Traci?
I think that's exactly right, Julie. You know, we'll continue to look for creative solutions to perhaps identify people who live in a non-group housing setting and see if we can further reduce that, but that will really depend on the availability of a good data source to do that.
Thank you for that. Let's go now to Ben Krumholtz, Fox 11 in Green Bay. Ben.
Hi, thank you for the opportunity. What percentage of tests right now are being tracked to see if they are variant cases? And how much has that changed since the state first started tracking variant cases?
Traci, would you have that data?
I don't have a specific number on the percentage of cases that are being tested for variants, but certainly I can tell you that we have been ramping up the number of specimens in Wisconsin that are sequenced to determine if they are variants. And that's really through our partnerships with the Wisconsin State Laboratory of Hygiene and clinical and reference labs. There's a significant effort nationwide to really ramp up the sequencing of COVID-19 specimens, and we certainly have been doing that as well here in Wisconsin.
Thank you for that. Let's go now to Stephanie Hoff at WisPolitics. Stephanie.
Good afternoon. Thanks for taking my call today. I was wondering if you could tell me, so for this new UW Eau Claire federally supported vaccination clinic, it says Wisconsin has committed to providing 3,500 doses from the state's allocation, and with the ability to do up to 7,000 doses weekly. So what percentage of the entire Wisconsin allocation is going to that site?
Oh, Stephanie, I don't know. That would require me to do some pretty quick math, but I think what I really want to focus on is this is a reflection of the fact that we have increasing supply from the federal government. As I've been mentioning, week by week, we see increased doses, and we anticipate a pretty significant jump around the 1st of April per predictions from the federal government. And so that has allowed us to plan for these sites and to be ready to give that kind of vaccine allocation to these sites. So similarly to the 7,000 doses per week that we are giving to the Milwaukee County site, we'll be able to contribute this 3,500 to the Eau Claire site It's a smaller population. That's why we're starting smaller. But based on demand at that site and based on increasing vaccine supply, we'll get more vaccine to them. These kind of clinics are high throughput clinics. They're an excellent way for us to vaccinate a lot of people really quickly. And we're standing them up in anticipation of both the large group of people, over 2 million people that we've announced with chronic medical conditions. It will provide access to that population. And then later this spring, when we open to all populations, it will provide access to the general population as they step forward for their vaccine.
Thank you. The next question now to Heather Poltrock, WSAW in Wausau. Heather.
Thank you. So we know that many people have been traveling outside of their immediate areas to other counties to find available vaccine appointments. Should people be waiting for appointments to become available in their immediate community, or is it okay for them to be traveling around the state in order to get the shot?
Well, you know, here's what I'd say. If people are anxious and eligible and find the opportunity to obtain a vaccine and have the means to travel, that's okay. Although I will say the challenge it places is we do allocate vaccine based on the population of a county. And if lots and lots of people do that, that means the people in that county won't have as much access either. The federal government has significantly increased access, though, outside of our population formula by putting vaccine at Walgreens and other pharmacies, Roundy's Food, and as you heard me just mention, now we'll be including Walmart and other hometown pharmacies in that mix. And so certainly traveling to those pharmacies, that is additional vaccine in those communities beyond the population estimate that we have made. The other thing I would say is vaccine is coming. Patience and persistence, folks. It won't be that long before in your community there will be more and more vaccine and more availability. But I think every person in this pandemic has had just a little different view, little different anxiety. And so I think we each have to trust people's own decision making. And again, I would reemphasize people who are eligible stepping forward and finding vaccine right now. We want shots in arms. People who are not yet eligible, I would ask you to please wait. You know, next week, many people with chronic health conditions will be eligible. And again, coming soon, everyone.
Thank you for that. The next question now to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. Milwaukee County announced this week they're opening up COVID-19 vaccine eligibility to adults in the county's 10 most socially vulnerable zip codes. Are there other parts of the state that you're working with to do a similar opening of eligibility?
Yeah, this eligibility is really focused on increased access in those communities for people with chronic illness. And we really appreciate the work that Milwaukee County has done, the important data analysis that they have done to really illustrate that those areas of high social vulnerability have the lowest vaccination rates in the county. And just the opposite is true. The places with the lowest social vulnerability have the highest vaccination rates. So in our conversations with them, one of the things that make those places high are most vulnerable is people don't have access to medical care. And so they don't even know that they have chronic medical conditions. So we know when you live in a neighborhood that has been impacted by systemic racism because you don't have access to the normal resources that other neighborhoods do, that you don't readily have access to a primary care provider who can diagnose chronic conditions, when you have lived with toxic stress for much of your life, you are likely to have a chronic condition. And so we are working with our colleagues at Milwaukee County to focus on those neighborhoods in order to increase access there. We are also encouraging our colleagues across the state to think of similar ways to increase access to people who might find barriers to getting vaccine, who may have experienced systemic issues that have prevented them from receiving care. And we strongly encourage our vaccinators across the state to be doing that. And one of the benefits of large sites like the FEMA site in Milwaukee and the FEMA site in Eau Claire and the community vaccination sites that the state is placing around the state is that it is freeing local health department staff in those communities to do this kind of work in neighborhoods that have less access to vaccine to help support residents of those neighborhoods. And that is exactly what's happening in Milwaukee with the FEMA staff coming to staff the site at the Wisconsin Center, the local health department in partnership with a number of other colleagues and organizations across the state are increasing access in those very important neighborhoods that have not borne the benefits of this rollout to date.
Thank you for that. Let's go now to Emily Fannin at CBS 58 in Milwaukee. Emily. Emily at CBS 58. A reminder, *6 will mute and unmute your phone. All right, why don't we try and see if David Wahlberg is on the call, Wisconsin
Hello?
State. Oh,
Hello?
is that
This
Emily?
is Emily, sorry.
Go
Yep,
ahead.
sorry about that. So my question is, I know Wisconsin continues to be a leader in administering vaccines nationwide, but neighboring states like Illinois and others are already vaccinating people 65 and younger with certain medical conditions. And Illinois plans to open up eligibility to the general public by April 12th. So my question is, what are the factors behind this in Wisconsin when it comes to when we can get there to open up to the general public earlier than May 1st?
Yeah, thanks for that question, Emily. As we've done throughout the immunization rollout, we have set eligibility for a given group, and then we have monitored both our vaccine supply and uptake in that group, and adjusted the next entry point for the next group accordingly. And generally what we're looking for are a couple of things. If vaccine appointments start to open up, it indicates to us there's not enough people in the group and we need to increase the pipeline of people eligible to receive vaccine. We also look at our best estimates of how many people are in that group. And when we start to approach 50% of a given group, we open up to the next eligibility group. And it also depends on how much vaccine we have coming in. As I've said, our vaccine supply has been creeping up week by week. And that is a big part of the reason we moved up eligibility for people with chronic medical conditions from March 29th to March 22nd, because we were aware more vaccine was coming and because we saw how quickly we were starting to immunize educators and people in Group 1B. And part of that is also because of this additional supply that is coming into the state through the federal retail pharmacy program. So we will continue to do those very things, monitor for, are we seeing open appointments, monitoring for how quickly we are vaccinating people in the new group 1C as we open that up, and how large the vaccine supply is, if we're actually continuing to see significant increases from the federal government, and we'll make decisions about when we may be ready to move to the general public based on those factors, the latest being May 1st.
Thank you. Let's now go to David Wahlberg, Wisconsin State Journal.
Thank you. Can you explain the rationale behind including people who are overweight among those with the medical conditions eligible next week, along with obesity? I think some people say, overweight, that BMI of 25 to 29 can include, muscular athletes and people who really don't have a lot of risk for conditions. So why do we include them?
Well, the list that we used to include people was based on analyses that the Centers for Disease Control have done, and their analysis of what conditions contribute to more serious COVID disease, including hospitalization and death. And so over the last year, they have done analyses and found certain conditions most certainly put people at serious risk, and other conditions that likely put people at serious risk. And when we were making our decisions about which conditions to include, we included both groups. And so we have relied on the analyses of researchers at CDC to identify which conditions do that. And in the case of obesity, it was in the first group, clearly increased risk. And in the case of people being overweight, it was in the most likely increased risk. And so we did not split the difference and included both of those groups. I think the other thing I'd add, David, is with increased vaccine supply, we knew we were putting a very big group in here, but we're getting much closer to being able to have supply to open up to everyone. So it didn't worry us that we were putting a larger number of people in the group, because the ultimate goal is move vaccine into arms as quickly as possible and protect as many people as we can as quickly as possible. And so we want to make sure we've got lots of people moving through the pipeline so that we can move from 23% of adults and of people in Wisconsin who have received vaccine as quickly as we can up to that 80% coverage level.
Thank you for that. Let's give the next question to Ryan Urban at the Barron News Shield. Ryan.
Hi. A few weeks
Hi,
ago,
Ryan.
A few weeks ago, you announced 4 mobile vaccination sites around the state. I wondered if you could give an update on those and when those are opening.
Mobile vaccination. Do you mean community vaccination sites?
Yeah, community.
Yeah, sorry. We have both. So mobile
Sorry.
move every day and so just needed to get clear. So we have opened a community vaccination site in Rock County. We have opened a community vaccination site in La Crosse County. We are opening a community vaccination site next week in Racine, and we will be announcing additional sites very shortly. Along with that, we know a number of our community partners have opened sites around the state, such as the great announcement of the site at Lambeau Field in Green Bay this week. We know that the city of Appleton is running a site at their expo center. We know Waukesha County is running a site. We also have the FEMA sites in Eau Claire and Milwaukee. And we have great partnership with the University of Wisconsin, who has partnered with healthcare providers and are leading sites at a number of UW campuses as well. In fact, our site in La Crosse is on the campus of UW La Crosse, but I know there are sites at UW Green Bay, UW Marinette, UW Sheboygan, and soon to be Manitowoc that are led by Prevea Health. There are sites at UW Oshkosh and UW Milwaukee that are run in partnership with Advocate Aurora. And we continue to work with UW as they think about will increase access for members of communities in communities with UW campuses.
Thank you. The next question to Angelica Sanchez, Fox 6 in Milwaukee. Angelica.
Hi there. My question is for families planning their Easter celebrations. I'm sure some are running into some family members having the vaccine, others maybe not. What's the recommendation from DHS on Easter celebrations?
Traci, would you like to respond to that?
Sure. I would really recommend that people go to our website, dhs.wisconsin.gov. CDC has released some new guidance for fully vaccinated individuals. especially related to interactions with other fully vaccinated individuals and unvaccinated individuals who are low risk from a single additional household. And you can get some more details on those interactions. We would continue to recommend that people avoid large gatherings, especially unvaccinated individuals. And of course, it's important to continue to do your physical distancing and wear your masks when you're out in public and use that good hand hygiene.
And let's hope for great weather so that Easter celebrations can be held outside, which we also know is a protection against transmission as well.
Thank you. Good wish. Now to AJ Bayakpour, WKOW in Madison. AJ.
Good afternoon, everyone. Thank you for taking this call. With regard to the pre-existing condition crowd becoming eligible on Monday, I noticed that on the sign-up form online for the Wisconsin Center FEMA site, individuals can start booking appointments now. In fact, there was an opportunity this morning, if I felt like driving over to Milwaukee and wasn't at work, I could have signed up, checking off the pre-existing condition box and make an appointment for later today in Milwaukee. Is there concern about that site or any others opening it up before Monday to pre-existing conditions? And to the point of another question about creating such a big crowd that becomes eligible, is this unofficially a free-for-all come Monday?
Yeah, I don't, in terms of people going early, at this point, again, we want to get vaccine in arms, and if people have open slots and have vaccine, I'm not concerned if they are putting people in on Thursday and Friday and Saturday and Sunday. That was a target date for our vaccinators to plan for and for us to allocate vaccine accordingly. So remember, we're at a point, vaccine is not as scarce as it was, and we're at a pivot point to we want to get vaccine in arms. I don't think it's going to be a free-for-all. I think what is really important is we want people to make room for those who have these medical conditions to get in the front of the line. You know, if you're someone who has been living with asthma or diabetes or a family member with multiple conditions, you've been living in an immunocompromised position, you've been living in fear of this virus for well over a year. So those of us who are healthier, hold back, let those who have these conditions move to the front of the line. They need it. They are at risk. They are anxious about this. Let's be good citizens and good neighbors, Wisconsinites, and let people go ahead and get vaccinated. And yet, if you're someone with one of these conditions that's milder and you see open appointments, as you did this morning, Adam, then I don't see any problem with going ahead and booking it and getting in line to get your vaccine.
Thank you. Next question now to Evan Vogel, TMJ4 in Milwaukee. Evan at TMJ4. TMJ4. All right, let's move on to Joshua Pagero, WBAY in Green Bay. WBAY Joshua.
*6 to unmute.
All right. No, Joshua, how about Ben?
Hello,
Meyer?
I'm sorry.
Oh.
I kept pressing unmute and it just, I don't know if it's like the phone. Well, I'm on now, so that's all that matters. One of the questions I just had, I don't know if you saw yesterday, for Wisconsin congressmen, one of them is Mike Gallagher, sent a letter to DHS seeking answers in terms of why Wisconsin apparently, according to them, ranks last in the vaccinations of assisted living facilities. Have you at all looked, and then they had shared a few spreadsheets from CVS as well as Walgreens. Have you at all heard about this? And if you have, is there an issue when it comes to the low rate of people being vaccinated at assisted living facilities in the state? Thank you.
Yeah, thanks for that question, Joshua. We initiated the assisted living program in January when we had adequate vaccine per the CDC's requirements to begin vaccination. We did that on January 8th. The program requires a 2-week notification for beginning that program. And we were actually able to start early because Walgreens and CVS were already in the state vaccinating our skilled nursing facilities. So they were able to start early on January 11th and start vaccinating some of our assisted living facilities. But we've got a whole lot of assisted living facilities in our state, over 4,000 of them. And it's a big, big job. We have a higher percentage of assisted living facilities in our state than many others do. And I'll turn to Dr. Schauer, who can give you an update on the progress we're making on that.
Yeah, sure. So with the skilled nursing facilities, that was the first part of the program that was kicked off. And really, they're completing their 3rd clinics this week. So all skilled nursing facilities in this program will be completed by this week. They are continuing to work with the assisted living. There's many more of these. These are smaller facilities. And we're nearly 90% complete with their 2nd clinics. And they're starting on that 3rd clinic to make sure that if there's anybody who still needs that last dose or even needs to start the series can be done. So they are making good progress, and nearly everyone has had at least opportunity to receive 2 doses, which is the full series. Through that program, we have administered over 184,000 doses through that federal partnership program to date.
Thank you for that. Let's go now to Ben Meyer, WXPR in Rhinelander. Ben Meyer.
Good afternoon, and thanks to DHS for providing this opportunity. Depending on which health official you ask, it seems as though 80% might be in the ballpark of the number needed to achieve herd immunity in terms of 80% people being vaccinated. I'm curious, based on vaccine supply outlook for Wisconsin, does DHS have an estimated time frame for when about 80% of the population could be vaccinated?
Yeah, based on anticipated vaccine supply, Ben, and this is based on estimates that the federal government is giving us, which they emphasize every time they give them to us. The longer out they look, the more risky the assessments are. We could always run into issues with manufacturing or some catastrophic event that would ruin some of the vaccine. But if everything goes as planned now, we anticipate that by the end of June, we would have enough vaccine in the state to have immunized 80% of the population, 80% of adults or people 16 and over who are eligible for the vaccine. So assuming we get supply as anticipated from the federal government, sometime by the end of June, we should have enough supply in the state. So supply is one thing, and then administration and demand are the other 2 important legs of the stool. That is why you continue to hear us expanding these community-based sites. I know our healthcare systems are also getting ready to give many, many more vaccines. Our pharmacies stand ready. And so we have a great network of vaccinators. And then all we will need over the next few months is the public raising their hand and saying, I'm ready. I want to protect myself. I want to protect my family with these very safe vaccines. And I want to protect my neighborhood and my community. And so we encourage people to make a plan now, learn more about the vaccines, think about where in your community you can get access to vaccine. And we're really hopeful. I keep saying, wouldn't that be a wonderful 4th of July celebration to have hit 80% community immunity in the state of Wisconsin?
Absolutely. Thank you for that. Now we go to Rachel Vasquez, Wisconsin Public Radio. Rachel at WPR.
Hey, thanks for taking our questions. I was wondering about the decline in the number of people getting tested for COVID-19. Milwaukee's main testing site at Miller Park has gone from 5 days a week of testing to 3 days because there are so few people getting tested. Do you guys think that this is because less people are getting sick, or people feel like we're kind of on the other side of the pandemic?
Well, I'd be interested in what Traci has to say about this as well. I'll just say I think it's a little bit of both of that. We do know people still have symptoms, and we do know people are getting tested who have symptoms, and we encourage them to do so. But Traci, any further insights you have into that?
I totally agree, Julie. And I think, some of the decrease in testing that we might be seeing at some of those sites may just have to do with the widespread availability of testing in Wisconsin. So people have a lot of options. You can go to your healthcare provider. You can order a test and do it at home through one of the services like Vault, or you can go to one of those community testing sites. So as there continue to be more options and less people who are symptomatic, I think that's sort of a natural decrease in the number of tests that are being performed at those community sites.
Thank you for that. Let's go now to Bob Haig at Wisconsin Radio Network. Bob.
Hi, thanks for taking the call today. We're hearing so much about the eagerness of people to receive the vaccine, but yet we also know that there are people who are still resistant to it for whatever reasons. I guess, what's the message to folks who, for whatever reason, don't want to get the vaccine?
Dr. Schauer, would you like to address that?
Yeah, sure. So, there's a number of reasons why folks may not want to step up and receive the vaccine. And I think some of those we initially heard were about folks were hesitant and wanting to see what happened they didn't want to be first and see how did their friends or neighbors or colleagues react. And I think the good news is that as we continue to see data come and we hear experiences of individuals, that the vaccines that we have are safe and effective. Most of the reactions that people have after vaccination are mild and self-limiting. And when people do feel a little bit off, a day or two after vaccination, letting them know that that is an expected piece of vaccination, that is your body responding. And that's actually a good sign that your immunity is building. And so I think as people hear others' experiences, they may go ahead and jump in. I think also folks are concerned about the process and that was used for vaccine delivery and creation. And I think it's important to remember that while it seems like these came quickly, it really is the result of lots of work being done behind the scenes years before on other vaccines. And so there was a good solid foundation for starting this technology and building these vaccines, and that none of the safety steps that were circumvented. All of the safety steps were put through in terms of clinical trials. They used large numbers of individuals to go ahead and look at the safety and efficacy, and that continues to bear out. So not only what we saw in the clinical trials was reassuring and allowed that these vaccines could be authorized, that the data that we have now, the effectiveness data, continues to hold up and support that. And we hope that that information reassures people and encourages them that these are safe and effective vaccines and will go ahead and avail themselves.
Thank you for that. Let's go now to Chase McNamara, WAOW in Wausau.
Good afternoon. Good afternoon. My question revolves around eligibility. One group that's being left out of this process and I've spoken with manufacturing groups from around the area and manufacturers here and workers. And per CDC guidelines, phase 1B or CDC recommendations, phase 1B was recommended to include manufacturing workers, but yet they are being left out of this priority list. So the question is why that decision has been made.
So thanks for that question. And when our state disaster medical advisory group began to look at the CDC list, and remember they were making these decisions about phase 1B in late January, early February, when we were getting about 50 to 60 to 70,000 doses a week. They knew, we asked them and they agreed that they shouldn't put a group in that was so big that we could never vaccinate, we wouldn't be able to vaccinate them for months and months. And so manufacturing is estimated to be about 500,000 employees in the state. And so that group was left off thinking of a future phase. Given where we're at with vaccine supply, as we moved into phase 1C and knowing we'd be going to the general population very soon, we decided to proceed with just 1C. As you know, that's over 2 million people. And so I would, as I've talked with our friends at Wisconsin Manufacturing and Commerce, I've said, make sure you let your employees know in manufacturing that many, many of them are going to be eligible for vaccine come Monday, because many of them will have one or more of those conditions. And as we've discussed, with vaccine supply increasing pretty quickly, the remainder of employees will be eligible by May 1st at the latest. And so we just felt like continuing to create eligibility by occupational group is confusing to everyone. And we are going to get there very soon. And many, many of those employees are now eligible because of the chronic health conditions, and we welcome them coming into the vaccine queue.
Thank you for that. And with that, we are at 2:15, so we do need to wrap up this call. We want to thank Deputy Secretary Julie Willems Van Dijk, Dr. Stephanie Schauer, Traci DeSalvo, and of course, all of you for participating. If we did not get to your question, please reach out to DHS Media, and of course, continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is